You on today? Okay, I know this is for many people, this is a big problem, something that they really don't want to have, while they're trying to wear their shorts for summer.
Certainly.
Varicose veins and spider veins, something you really don't want. So Dr. Kent Webb joins us this morning with Trinity Clinic Vascular Surgery. He's going to tell us a bit more about some ways that maybe we can prevent these or how these even occur. Good morning.
Good morning, Rachel and Robert. Thank you for having me today.
Yeah,
varicose veins and spider veins are really the most common vascular disorder, which is disorders of arteries and veins. And almost everybody has them or knows somebody in their family that has an issue with varicose veins and spider veins. Varicose veins are bulgy veins above the skin surface. Spider veins are the smaller, fine veins that lie along the skin surface. And there's different treatments for both of those, but we have some exciting treatments that we've been using recently, and would just like to share that with you today.
And so, when we were talking at the break, there's not really a one-stop fix. Do you sometimes have to continue this, and what are some of the specifics, and how is that done? How do you treat it?
Well, there's a variety of different treatments. Varicose veins tend to form over time. Risk factors are heredity, family history, job description, so people that stand or sit a lot like you and me. And also pregnancy and obesity are risk factors. But some people don't have really any of those risk factors and develop spider veins or varicose veins. So everybody at some point in their life is likely to deal with this in one way or another. And not all of these need treatment. But certainly, if patients are having significant pain in their leg, swelling, discomfort, aching, tiredness, heaviness in the leg, those patients are good candidates for some of the minimally invasive treatments that we have.
And now, what are some of those minimally invasive treatments that you do have over there at Trinity Mother Francis?
Well, it used to be in days past, when I was doing my surgery residency over 20 years ago, all we had to offer was surgery. And where we would do a vein stripping, which is a procedure done in the hospital with multiple incisions to remove veins. Now we have minimally invasive procedures. Most of these are done in the office. One of our newer procedures is called a catheter ablation. So it's done through a needle puncture, where we guide a special catheter into the abnormal vein under ultrasound guidance. We numb up along that vein with some injections and some sedation, and then we treat that vein with either a radiofrequency catheter or a laser catheter, which causes that abnormal vein to close down and helps promote circulation in the leg. Because the main problem with varicose veins is the veins normally have to move blood out of the leg against gravity. So they have to move blood up back to the heart, and they return the blood back to the heart. They have a series of one-way check valves that open and close that act just like one-way valves. And sometimes those valves can get leaky and allow blood to pool in the leg. The blood then sits in the leg, can cause swelling, aching, and over time the veins bulge out, and then can cause skin changes like darkening of the skin, thickening of the skin, and in severe cases, sores or ulcers can form around the ankle. So it can be very debilitating to a lot of patients. So the first line of therapy is conservative therapy with elevation and support stockings. The support stockings help compress the leg and push the blood back to the heart. But for a lot of us, wearing those on a full-time basis is not optimal, because when it's 100 degrees outside in the summer, nobody wants to wear some thick compression hose. So we have these other treatments that we can use to help promote the circulation and close the vein down to direct the flow into normal veins where it can empty out of the leg. And then with spider veins, that's mainly a cosmetic issue, but we have treatments where we can use a tiny little needle and inject a special FDA-approved medicine into the vein that causes that vein to dissolve over time.
Well, this is some great information. Wow. Thank you so much for stopping by this morning, Doctor, and we'll have more information on our website. Thank you again.
Thank you for having me.
Coming up on Fox